Hi, my name is Kevin Dayao. I'm a final year medical student at the Ateneo School of Medicine and Public Health, and I'm a clinical intern at the Medical City Ortigas and Ospital ng Makati. And I've been using JOMI for about 2 years now. I got a subscription for my clinical rotations for the past 2 years, and JOMI's really helped me in the surgical rotations because it fulfills its purpose because it allows for a virtual shadowing experience, and a lot of the information that you get on surgeries you can read about, and they tell you what to do and why it's being done. And JOMI is great because it actually shows you the actual procedure and you get to see it from start to finish in an actual video. And it's self-explanatory of why that would be a great thing to have, but it's actually also great for us as interns and clinical clerks and medical interns because we get something that reading in the books doesn't give you. It allows you to be able to see what we have to do. Let me explain. So a lot of books will tell you information about the surgery, and it's all about what the main surgeon has to do. They have nothing on what the assists have to do. They'll mention it. For example, like we have to suction. The assists have to suction and the assists have to retract. But they're never going to show you how to do it in a textbook. In a JOMI video, you get to see that. You get to see where the assist is going to stand. You get to see a pair of retractors come into frame, and you get to see a pair of scissors that's cutting the sutures. And as a medical intern, I get to see that, and I see a pair of retractors come into frame, and I go like, oh, that's me. That's my job. And seeing that really allows me to be able to visualize what I will be doing in the OR before I scrub in. And I like being able to do that because as much as we want to help the patient, and as much as we want to make sure that their procedure goes smoothly and the patient is safe, we're actually also kind of looking out for ourselves, and we don't want to get yelled at in the OR by surgeons. And that happens a lot if you don't know what to do. And JOMI helps because it gives me that perspective of what I will be doing throughout the procedure, just because I can see the assists in the videos and what they're doing, and it allows me to visualize and anticipate what I have to do in the OR. And these are things that nobody's going to teach you. The residents, they're not going to be able to, if you ask them, Doc, what am I going to be doing in the OR? They're not thinking about that. They're not thinking about what you're going to have to do. You have to look out for yourself and be able to do that. And JOMI is one of the few resources that allows you to do that. And one of my other favorite things about JOMI, probably my favorite thing, is that the small short animations at the very start of each surgery, those are really helpful. The 2-3 minute videos that show an animation of from start to finish what's going to happen, because it allows me a really quick overview of the surgery. Worst case scenario for us is that we don't get to know what we're going to scrub into. Usually interns will get assigned to surgical cases the day before or the day of, and worst case scenario 15 minutes before the actual procedure. And given that we don't have much time to review on the procedure itself, because we have to focus on the patient and why that particular patient is having that surgery. So if we suddenly get assigned to a case 15 minutes before it's going to happen, we have to go to the patient and find out what happened in their clinical history and why they're going to have the surgery, and spend about 10 minutes doing that. And we have about 5 minutes to actually learn about what the procedure is going to be. And if it's your first time going to scrub into a procedure like that, those 3-minute videos, they're very helpful. And another thing that I love about JOMI is that I was scrubbed into an rectal case one time, and then I was watching the video of the procedure, and I said, wow, the guy in the video kind of sounds Filipino. And then I checked the author of the article. He was actually from Philippine Children's Medical Center. And I was like, wow, okay, they actually have Filipino doctors publishing on this website as well. So JOMI is great, not just for learning about surgeries if you're interested in the surgical field, but it also allows medical interns who probably don't have any desire in going into surgery. It just allows them to be able to see the procedure and figure out what they have to do during a procedure, and allows them to perform better during their clinical rotations just from that, even if they're not really interested in joining surgery down the line. And yeah, I think it's a great resource that anyone in the medical field should be using. Thank you so much.